Hi, my name is Polivka, and I'm the Director of Physical Therapy at Balance Gym, and this is...
Ori Gorfine, personal trainer and manager at Balance Gym.
Today we're going to talk to you guys about foam rolling and other types of soft tissue mobilization techniques. We have a variety of different tools here today. First, I'm going to describe to you guys why you want to actually use soft tissue mobilization techniques in your fitness program. This is just a quick demonstration. Most of us know that we've had trigger points or different type of knots before build up in our muscles, ligaments, tendons, anywhere really in the body. If you think about having a big knot that sits in the middle, so let's say this is your quad muscle, this would be your knee, this would be your hip. If you have a big trigger point or some type of knot that's formed in your tissue and all you do is stretch to warm up, all you're doing is pulling on the ends of that muscle and trying to lengthen it from the joint. That's why people will get a lot of knee pain and hip pain associated with overstretching without taking some time to focus on the knot. If I apply some sustained pressure to that knot, increase the blood flow and circulation over that area, and roll that area out using a soft tissue mobilization technique, and then I go ahead and try to stretch at it now. You can see now I'm actually lengthening that area of the knot and getting rid of the problem that exists in the middle of the muscle. So you might see in the gym many different tools people are using today in order to do these techniques. One of them is a foam roller. This might be different than the ones you usually see. It's one I like the best. It has different types of knots and edging in it for different places on your body. You might see the double tennis ball. This is a small roller that really works well for the foot and the lower leg. And then last, you might see people using tennis balls, lacrosse balls. This is my favorite. It's from Trigger Point Performance. And we're going to show you guys how to use all of these today, just one small example. First, you can think about the foam roll as sort of more of an evaluative tool. This allows you to take broad strokes and roll over a certain area. Lets you know where you really have those restrictions and tender points. Then once you find the restrictions and the tender points, you can use any of these other techniques to really focus on those areas and release the knot. So today with Ori, he's going to start by rolling the foam roller over his IT band. So he'll lay on the ground. One thing everyone has to remember when you use the foam roller, it takes a decent amount of shoulder girdle and core strength because he has to hold himself up here. For the IT band, you'd want to take your top leg, place it in front of your bottom leg. This leg is your anchor so that you can push your body up and down so that this leg can completely relax. As he rolls up and down, especially over a large area, which is your IT band that goes from the knee all the way up to the hip, is you want to do it in two sections. So roll from the hip to the middle of the thigh, spending about 30 seconds there, then roll from the middle of the thigh down to the knee. Now, Ori, when you find a spot that's tender, go ahead and stop and just pause on that. Now you're going to do what's called a tack and release technique. So you're going to keep downward pressure onto the foam roller, but I want you to bend your knee back and then back out. You don't have to go through the full range of motion, but you always want to add a little bit of movement to the foam roll technique. That's just because after you sort of increase the blood flow and the circulation through there, now he is going to take some time to stretch over that area as well. So that's how you would use the foam roller over the IT band. Now let's say up at the top here, this is an area, it's called your TFL muscle. Lots of people with lots of squatting, deadlifting can get some trigger points there, especially people who sit all day at work. So he's going to take the ball, he's going to localize it, lay right on the TFL. If you find the top of your pelvis and your hip, you just make a diagonal line to those two places, and that's where he's going to lay. So he's just going to lay flat on the ball. You really need to just put pressure onto the ball. So first you need to take at least 20 seconds to just let the tissue relax. You don't want your nervous system to get all excited and feel the pain and then just go into a spasm. So after he relaxes onto that, now he can add the same technique again. He's going to bend his knee back and forth just a little bit over there. How's that feel?
Pretty painful.
And again, just spend 30 to 60 seconds, and then just change your anchor too. So just lay a little bit farther flat, and you can probably feel you get a different area of that muscle. I look on his face, I take that as yes. All right, double tennis ball. What you want to do with this is we're going to focus on the spine. He's going to actually, thoracic spine is the middle part of your back. Lots of, go ahead and lay back down. Today with sitting, this is an area that gets really uncomfortable. The reason you're doing the double tennis ball is because we're putting pressure along the areas of the spine. As he sits and relaxes there, we can do a couple things here to improve the mobility in the spine with the tennis ball. He's going to take his hands up overhead and move one arm overhead and back, and then the other arm overhead. Go back and forth with the arms. The spine needs to extend more as the arms go overhead. And then he's going to work on rotation. So he's going to drop one arm out to the side, and back to the center, and back up. Last thing here is doing another type of tack and release technique. He's going to put his hands behind his head. He's going to think of doing just a little mini sit-up over the tennis balls. So you're not trying to lift your body off the tennis balls, but you're just moving back and forth. When you do this, you just need to do 5 of these in all these different directions we just talked about. Now, last thing, and this is my favorite tool, is the foot tool. And this again is a Trigger Point performance tool. You can order these online. Running stores in the DC area carry them as well. Now, one of the best things here is it's really hard to get rid of a lot of what we call fascial adhesions down in this lower part of the leg. It's where a lot of athletes complain of pain and discomfort. So here he can prop himself up. You can put this up on a yoga block sometimes too, that helps. And he's going to roll over the area, just back and forth, small places. Find an area that's uncomfortable. He's going to have his toes fall out, his toes to the ceiling, his toes fall in, working the entire region. When he gets to a point that's uncomfortable, now he's going to just hold the pressure there and just make circles with your foot, pull your foot up and down. And he's just going to apply that pressure and move over the area of the tissue in the lower leg. This is also a great one as well to work on the bottom of your foot, so you can actually stand up. If I was in bare feet, I would stand up and roll here. What I want to do here is work on the plantar fascia of my foot as well. All of these things, work each part of the body 30 to 60 seconds. Like I said before, put them into your program. You can do them before, during, and after your workouts. Thank you.